What's up, you guys? Welcome to my channel, Nursing with Key, where I make a whole bunch of nursing videos showing tips and tricks that I have learned along my journey to help you guys have the smoothest nursing journey. So in today's video, on my first rotation, I was sent to an LTC facility. For those of you who don't know what LTC stands for, it means long-term care facility. So it wasn't even really like a medical rotation. It was really basic care. So it was a rotation that we did just to kind of start getting familiar with, doing bed baths and, just giving basic care pretty much. So on my first day, I was told to shadow a nurse. I met the nurse that I had to shadow, and she was taking care of a patient who had a brain tumor. Now, this patient who had a brain tumor was actually at the hospital for a very long time. If I'm not mistaken, I think the tumor was growing. This was a while ago, so I can't remember all the details of the story, but the patient had a tumor, and I believe the tumor was growing, and it was pressing on the part of his brain that was responsible for speech. He got surgery done, so the neurosurgeon was able to remove some of the tumor, but not all of it. So some of the tumor was still there, and it was pressing, like I said, on the part of his brain that was responsible for speech. So he would make random sounds, and at first I thought he was in pain, but when I had asked him if he was in pain, he said that he wasn't. There was something else that was wrong with him, but because, basically when I got there that day, my teacher was kind of like, okay, go shadow this nurse. And I didn't really have the chance to actually look into this patient's chart or look at all the details to kind of know exactly what his diagnosis was, because I wasn't really the one taking care of him, really. It was the nurse. I was kind of just looking at her take care of him and kind of assisting her. So honestly, I would say that I was playing more the role of a nursing assistant than I was like a nurse or nursing student that day. So we went into the room to see the patient. The patient was on isolation. I think it's because his immune system was so weakened that they didn't want to allow just anyone in there. So his door was shut. They didn't want any bacteria or anything going into the room. So he was on isolation. We went into the patient's room. I met him. He was very smiley, very sweet the day that I met him. He was able to talk. However, it was hard to understand him. But he was able to talk. He was able to, communicate with me with hand signs and head signs and yes, no. And I just made sure that I wasn't asking any ridiculous questions or starting any super long conversations. So I really tried to ask open-ended questions. Is it open-ended or closed-ended? I don't know, but questions that would be answered by yes or no. So I met the patient. I met the patient's family. They were very sweet. The day that I met them, you could tell that they were kind of sad because I think not too long before that, the patient was, and he was perfectly fine. And then, all of a sudden his life completely changed, and, he just kind of switched up on everyone within a matter of days. So it was super, I guess it was very hard on the patient's family. However, I met them. Everyone was very sweet. Everyone was very nice. He was very energetic, but he was bedridden, so he was unable to do anything for himself. Now, you guys are probably wondering why this patient was admitted to LTC. They got him back to a state where he was stable. However, he was not supposed to be palliative. He was not a palliative patient. But because he was bedridden and because he wasn't able to move or stand or do anything for himself, they eventually admitted him to a long-term care facility, even though he wasn't elderly, just because the patient's family didn't have the material to take care of him at home. So they didn't have lifts, and they didn't know the proper techniques to turn him, to change him, and things like that. It was very, very hard. And if you've ever cared for a patient who's unable to move, they are heavy. They are heavy, these people. So they admitted him to LTC so that we could take care of him. So we took care of him that day. My role was kind of just to check his vital signs, to monitor him, to just kind of watch him and make sure that everything was okay. And that day I was also given 2 other patients that I would have to provide basic care for. So that's pretty much what I was doing during my first day. So the second day now, I go in, and me and the nurse that I was shadowing actually started our shift at the same time. So we would kind of meet up in the locker room, and then we would go up together, and we would go get report from the rest of the nurses that were taking care of that patient that night. And then we would go in and, do our job. Well, do her job, and I was watching her do her job. But anyways, we would go in and do what we have to do. And so we were told by the nurse that worked the night shift that he was not doing well, that his vitals were, starting to decline, that he wasn't really responsive or anything, which is really crazy to me because just the day before he was, perfectly fine, full of energy and everything. So you see how your health, like your condition can change in a matter of like minutes, no time. So he went in to see him. I held his hand because the first day I went to see him, he kind of held my hand and he smiled at me and he was laughing and all of that. So I went in and he was so weak he wasn't even able to like open his eyes and look at me. So when he heard my voice, he kind of opened his eyes and then he just shut them back, and he was very unresponsive. He wasn't talking, he wasn't smiling, he wasn't doing anything. So obviously the patients got very, very frustrated, and the patient's family, is that what I said? Yeah, the patient's family got very frustrated. They were very sad, and they were really on my back. Now, I didn't really take any offense to it. I knew that they were going through a rough time. I knew that they just wanted answers, and unfortunately, I couldn't give it to them because I didn't really know what was going on. It was my second day there. I didn't really know the patient too well. I didn't really know his condition. There was nothing I could say, and on top of that, it wasn't my job to tell them anything. That's the doctor's job or, the nurse's job, and I was none of those. I was just a nursing student who was clueless and still learning. So, even though I tried to explain to them several times that, I was going to try to get answers for them, try to get someone to come answer their questions, they wanted answers right away. So they were very tough on me. They made it very hard for me. But like I said, I didn't really allow myself to get offended by it because I knew that they were going through some tough times. And I knew I met them the day before. They were very sweet people, but I knew it was just like the anger and the frustration that was talking, not really them. So I went to take care of the rest of my patients, and I came back to see the nurse. The nurse told me that he was not doing too well. Went in the room, and I heard him kind of wheezing. Like, you could tell that it was kind of hard for him to breathe. So naturally, I elevated the head of the bed. If you guys don't know, if someone has difficulty breathing, the first thing you do is elevate the head of their bed. So I elevated the head of his bed, and I went to call the nurse. I know that I probably should have given oxygen. However, because that was my basic care rotation, we were strictly advised at first that we were not allowed to give any medications during our first 2 weeks or 3 weeks. We weren't allowed to give medication. So I couldn't give him oxygen because oxygen is considered as medication. So I had to go call the nurse. I rang the call bell, and I tried to go out on the floor to see if like there were any like nurses around, not necessarily the nurse that I was shadowing, but just anyone who could come give him oxygen. So she came. I took his O2 sat. Right after I elevated the head of his bed, I actually took his O2 sat. His O2 sat wasn't really good. It was like in the 80s, like not even mid 80s. Like it was around 81, 82 or something like that. Like something really, really low. So it was no good. They told me to go get the oxygen. Cause that usually the oxygen is kind of like on the wall, and you can kind of just hook up the mask and give the oxygen. Not like that in LTC. You guys need to remember that LTC they're not hospitals, so they're not equipped the way the hospitals are equipped. So I actually had to go get an oxygen tank. Like it was actually a tank. Like a huge tank. It probably was from the floor to my stomach or a little bit higher. It was a very big tank that we had to push, and then we had to connect. The nurse that I was shadowing actually allowed me to connect it, and she actually she gave it, but she allowed me to connect it, and she kind of guided me through what she was doing and whatever. And she gave him the oxygen, and we were still monitoring his vital signs and all of that. And the next morning, when I came in, we got him back to a stable state, so I was able to continue my shift and then leave. And then the next morning when I came in, same thing with the report from the nurse and everything. And she said that he was doing even worse than the day before. So his O2 sat kept going down. He just wasn't doing good. He wasn't responsive. He wasn't doing anything. And I went in to take care of the rest of my patients, and then the nurse that was shadowing came, and she, told me to come see her afterwards. And then when I went into the room, everyone was kind of silent. The nurse that I was shadowing kind of put her head down, and I knew, okay, so it's only a matter of, time before so-and-so happens. Before, dies. And he was also a DNR patient, so a do not resuscitate. So there was, we weren't gonna do any like extreme measures or anything. I think the nurse actually did call paramedics when his vitals started to go down. But like I said, he was a DNR, so like no one was really rushing, as sad as it sounds. And I'm telling you that, like, if you go through this, it's gonna be very frustrating. I really do not like when people are DNR, because you want to help people, you want to keep them alive, you want them to get better and be healthy. But like, just to have to kind of see someone's condition decline, or see someone in a certain state and not be able to do anything about it, it's no bueno. It's not good. Anyway, a couple minutes after that, he unfortunately ended up passing away. The family was very upset. They were upset with us. They were upset with the nurse. I think they felt like the nurse didn't do as much as she should have, or whatever. Mind you, the person who is the patient is the one who signed the DNR. So even if the wife wanted for him to, whatever, he wanted a DNR. He signed the DNR. He sent the DNR like before he did his surgery and whatever. So there was nothing we could do. But it was very sad, but at the end of the day, I was still able to, I didn't allow it to get to me. And honestly, I was very surprised, because I always thought that, especially when I first started nursing, I always thought that I would be very bummed, that, my day would be ruined if one of my patients were to die, or whatever. But you develop this kind of, I don't know what to call it, superpower, where like, you kind of just start to realize that, wow, like, you're not going to be able to save everybody, right? If nurses could save everyone, then that would be great, but you're not going to be able to save everybody. And that's just the reality, and something that we all have to get ready for. But at the end of the day, even if you can't save everybody, you still get to make a difference in somebody's life every day. And making a difference doesn't have to be like, this huge deal. It doesn't have to be like some big procedure. You don't have to, do CPR on someone or anything like that, like resuscitate someone in order to make a difference in their lives. No, like, mind you, there are some patients in LTC who have children, who have families that they have not seen in years. And some of them don't even have family. So you are all they have. You are, their family, you are their friend, you're the only person they have. They wake up and they look forward to seeing you, because you're the only person who comes to see them and actually show that you care. And sometimes making a difference in someone's day or making a difference in someone's week can be something as simple as just sitting down with someone, holding their hand, and just listening to a story that they have to tell. And just having someone actually listen to them is enough to make, their entire week. I'm telling you, I've seen some people's like mood completely switch just by me sitting down with them for 5-10 minutes, on my break, or at the end of my shift or something. Sometimes I don't even go on my break. Sometimes I'll clock in for my break, and then I'll go with one of my patients, and I'll sit down with one of my patients and actually listen to their stories and talk with them and just keep them company. A lot of them don't have anyone. So at least, even if you can't save everyone, at least you get to leave work every day knowing that you made a little difference in someone's day, and that you tried your best. And if that's not worth it, I don't know what is. Remember, we're nurses. We're not God. So I don't get to decide when your last moment is. I can try my best. The doctors can try their best. The nurses can try their best to do everything that they can. But if it's your time, it's your time. And that's in the hands of, the Most High. That's in the hands of God. Like I said, at least you get to leave work knowing that you tried your best and you did everything that you could. And to me, anyways, guys, I've been rambling for a really long time. I don't want the video to be too long, so I really hope you guys enjoyed this video. If any of you guys have had any experiences with death, leave your stories down below. I would really like to hear how you guys dealt with the family and the whole situation. We can all learn from each other. This is why I created this channel. And anyway, I really hope you enjoyed this video. Don't forget to like, comment, and subscribe, and I hope to see you in my next video. Bye.